But now it's very exciting for companies like ours, with a biology-based solution, to be able to advance our technology to the point where we can help change maternal health outcomes. I started my career at a research bench where I really learned that I preferred communicating about science more so than actually doing the science. And that really led me to a career of working with innovators and scientists to translate their innovation for the health and well-being of others. And so I've spent a couple decades working across the industry, ultimately arriving here at Mirvi, where we're working on preeclampsia and pregnancy complications to really make it easier for maternal health outcomes to improve. Mirvi is a company that's developed the very first ability to predict preeclampsia, which is one of the most common conditions of pregnancy before it happens. So our test, which was just launched last year, is now available, and it's really changing how physicians and pregnant patients manage their care throughout their pregnancy. So what we're really encouraged by is the fact that biology-based solutions are now taking hold. So for a very long time, women have been left out of science completely. It wasn't until 1993 that we began including women in clinical trials. So when you look at maternal health outcomes and why they're so poor, it's not surprising. But now it's very exciting for companies like ours with a biology-based solution to be able to advance our technology to the point where we can help change maternal health outcomes. The hurdle in scaling today in women's health really is the fractured pricing structure of healthcare in the United States. Women's health is a shining example of our broken pricing system. Today, an hour of an OB's time generally is compensated at lower rates than other medical specialties. That has a cascading effect whereby not only are women's health services devalued, but there just isn't the opportunity for dollars flowing in from investors or innovators. So what is exciting is that is starting to change, and we know that women's health needs to be a priority. And so I think while I think that's changing, it's still a hurdle. One of my most favorite recent campaigns was the Bobby campaign featuring Cardi B. I thought that was just a breakthrough campaign. And what I really liked about it is it wasn't afraid to address the tough issues. So Cardi B was a voice and an advocate for every mom. And what I really liked is it was not only breakthrough creative, it looked beautiful, but the content was so spot on and I think resonated with any mom, any woman. And for that reason, I think it's so important that their creativity is helping break through and breaking the stigma of not only what it's like to formula feed, but also just to be a mom in general. If I could go back in time and talk to my younger self, I would remind her that life is just a series of adventures. And while you can try and plan, you have to be open to fate, you have to be open to luck, you have to be open to listening what is really important to yourself. I think I'd probably stress less and just enjoy the ride a little bit more.